Hello, this is Dr. Herman at Agape Upper Cervical Health Center, and today we're going to go ahead and show you how to do the Blair Prill leg checks. First thing to do is get your patient on the table correctly. Make sure they're standing at the end of the table evenly, and then ask them to have their knees together. And can you go ahead and bring your knees right about here on the table and make sure they stay together for me, please? All right, then go ahead and go forward without moving your hips, putting your face into the paper. Thank you. And go ahead and turn your palms up. We rather the palms up to allow the shoulder girdle to be much more relaxed. If their hands are down, they'll tend to grip the arm rest. Okay? So next you're going to stand at the end of the table and look at the patient's leg length. So you want to put your hands so your thumbs are right underneath the heels. Push in gently, and we're looking at where the shoe meets the top of the heel. So we're just pressing in, all right, and looking for any leg length difference. All right. Once you do that, then we're going to do the Derefield leg check. We're going to raise the legs up a little past 90, looking for the legs to either balance or one to go shorter. Once we've done that, we'll go ahead and do the cervical syndrome. Can you go ahead and turn your head to the right for me? Again, looking for balance, back to the center. Turn your head to the left for me, and back to the center. Okay, then we're going to do the same thing with it down. Go ahead, turn your head to the right for me, back to the center. Turn your head to the left for me, and back to the center. Again, looking for leg length difference. Now once we've done the cervical syndrome, now we're going to go ahead and do the Prill leg checks. Now the first Prill leg check for C1, we're going to gently press our hands right above the heel and slightly on the posterior tibia. So can you gently raise your legs against my resistance and relax. We want to do it for about a count of 4, and we want the whole leg to be raised. We don't want them to bend the knee. All right, and then we're going to look again for a leg length difference. So again, can you gently raise up against my hands? 1, 2, 3, 4. Relax. Put it pushing in firm, looking for change in leg length. Next, we're going to do C2. Now C2, it's rotational. So we're going to bring the patient's feet outward, just like this, and ask them to rotate their feet towards the center. Can you bring your toes together for me, please? Applying gentle resistance and relax. And again, looking at the base of the shoe of the heel, at the top of the heel, looking for change in leg length. Now some people put their hands at the bottom and rotate out. I try not to put my hands at the bottom because often you don't know where people step on their way into your office. So again, I keep my hands on top, bringing the legs, the feet out, and ask them to rotate gently inward. And relax. Thank you. So that's C2. Next is C3, which we call medial. So go ahead and press gently against my hands inward and relax. And then we look again for changes in leg length. That is the medial rotation for C3. And then next we'll have them press outward, which is our lateral. Go ahead and press against my hands for me, please. And relax. And again, looking for leg length. So again, we're looking at difference in leg length as we do each one of those gentle tests. Remember that this is not a full muscle strength test, so we don't want the patient to push all their force against our hands. We just want gentle pressure, just enough to engage the muscles, get the neurological structures working in order to see if we do have change in that leg length. So that's how we do the leg checks for our patients using the Prill, also the Derefield, and the cervical syndrome. Thank you for your time. Have a great day.